Winter weather and holiday gatherings have given rise to the usual gamut of viruses, but of current concern is a spike in infections across the island. In the lead up to the Christmas holiday, the Epidemiology and Surveillance Unit warned of an increase in reports of fever and respiratory symptoms, including COVID-19, common cold, strep throat, RSV, and influenza. A spokesperson for the Ministry of Health said, of particular concern is the elevated level of influenza cases, which is significantly above normal for this time of the year. According to Dr. KYJUAN Brown of Northshore Medical, the weather and a rise in social events are factors driving the current uptick.
The increase in cases are contributed mainly by a change in weather and also increased social gatherings. As this time of the year, people are gathering around. We just had Christmas, and Boxing Day, and now we're on to New Year's. So that's usually the cause of it, and also seasonal change. What people have to understand is just like how we have seasonal flu, we're going to have seasonal COVID, right? And there's going to be a new strain that's going to come around every year for the foreseeable future.
Most recent of the strains is JN1, which is spreading rapidly in many corners of the world, including the United States, where it accounts for nearly half of the country's COVID cases. The symptoms of JN1 are similar to those caused by previous COVID variants, including a cough, fever, body aches, and fatigue. But experts say it does not appear to be causing severe illness in most people.
JN1 is now high in circulation in the States, is about 44% of cases, and there's a few hospitalizations. We are finding that it's a lot more transmissible. There is about 38 new mutations on the spike protein itself, which may make it a lot more transmissible, but we aren't seeing it uh, create patients to be that sick where they have to be hospitalized per se. There may be those individuals that may be immunocompromised, or this may be the first time they've ever received the COVID virus, and they're unvaccinated. Those individuals, may get very sick, but generally the population who is vaccinated and/or have been inoculated with the virus previously um, would have a degree of immunity.
Dr. Brown said COVID cases are going unreported on island and suggests the virus is running rampant through the community. And although respiratory illnesses are common around this time of year, he says at his surgery, he has observed that people are sicker and their symptoms are lasting longer.
What I am seeing is that people are a little bit more sick and the symptoms are lasting a lot longer. I think there's a number of factors in around vaccinations, the flu and or mixed with COVID. So there's a lot of different things that are going on right now. People's immune systems are just pretty much not as strong as they used to be for various reasons. So patients have to be aware that if the flu or if their cold and flu-like symptoms are not really resolving in 4 to 5 days, and they're going on for about, this is now week 2 or week 3. Usually at week 2, you should be seeing your physician for a checkup in that regards. And if it's going on for 3 weeks, you need to be seen.
Persistent coughs that keep you up at night or cause chest pain, and mucus that changes color from clear to green to brown are also signs to look out for that warrant a visit to your physician, added Dr. Brown. And a reminder that among the best ways to avoid infection, and especially for the elderly and others at high risk, are to avoid large gatherings, practice good hand hygiene, and when in closed spaces, practice social distancing. Elisa Bernardo reporting for Bermuda Broadcasting News.